some tweets there, and I think from what I was able to see, it's already definitely not an issue. We already know this. This divides people. We have a lot of different opinions on this. Why? What are some of the primary concerns that small businesses have about this law? This is not popular with everyone I know.
So I can jump in and talk a little bit about what this means to everyone, including small businesses. Missouri Healthcare for All is committed to the principle that every Missourian should have access to quality, affordable health care. And to us, the Affordable Care Act tries to address some of the shortcomings we've had in our healthcare system. And as you mentioned before, small businesses have been one of the groups most affected by the problems. So I know of small businesses that it's hurting their budget and their bottom line every month because they make the commitment to provide health insurance to their employees. They're able to make it work, but it makes it a lot harder to keep their doors open. I know small business owners who are putting off important personal health treatments that they need because they're afraid of losing their own personal health insurance. And people that unfortunately have had to leave small businesses that they really loved because they had to go to a job where they could get health insurance benefits. So a system that's going to make it easier for small businesses to provide health insurance and for small business employees to get their own health insurance if they don't get it at work, I think will help small businesses and their employees.
But not everybody thinks it's going to be easier.
Yeah, I think one of the problems that we're having with this is what are the costs going to be for the small business, and particularly with the exchanges, it's a little bit of a black box. We really don't know what the costs are going to be associated with, or even how they're going to be able to drive competition between the various insurance companies. So I think, and as an entrepreneur or a business owner, you want to know very certainly what your costs are going to be for the next 3-5 years. You want to be able to write that down. You want to be able to account for it, and right now they can't.
Right. Planning is a big problem with what employers face right now and what they will continue to face with the law. I mean, the employers that I deal with every day, the biggest struggle is cost. So to what Jen was saying about how unaffordable things can be for small businesses, insurance brokers in the insurance industry, and I don't work for a large insurance company. I'm a small business owner myself. I'm an independent advisor that works with businesses on trying to develop their planning and works with employees directly. They're really struggling with the cost of this, and they don't see the ACA as improving that, to be quite honest. A lot of them are about to get a big wake-up call. Now, if you have employer groups that are an older demographic, that have some significant claims issues that have been driving their cost, they might see some help from this community rating system. However, younger, healthier, and primarily male groups could get a major rate increase from this. On top of the cost of the premiums, though, you also run into issues with compliance. Compliance is a big problem with ACA because employers were struggling, particularly small businesses, were struggling to meet all of the compliance requirements that they had before under laws like COBRA, and now you just compound that exponentially.
Are you talking about businesses kind of doing what we talked about there with the 49 and the 29 and finding ways around it, or are you talking about a different compliance issue?
Well, both are actually issues. So on the one hand, you have the compliance issue of now they have these summaries of benefits and coverage that have to be given out within certain timelines. They get these MLR rebates, but they have to figure out how to distribute them, and they're getting very little guidance on that. There's more rules that they have to comply with ACA than what they had to before. With the 49ers and 29ers, though, you do have companies that are looking at restructuring how they hire and their employees. Maybe they don't hire that extra employee. Maybe they convert folks to part-time. The first 30 people that they have full-time, if they're subject to the penalty, they get for free. So if they can convert more of their population to part-time, they could avoid the penalty and potentially drop their plan altogether. One other thing that we're seeing, though, too, that's coming out with this, the regulatory guidance that came out on the affordability test, you can't get the subsidy in the exchange unless you either have no insurance, the insurance doesn't meet the essential benefits test, or it's deemed to be unaffordable. So, but the unaffordability rule is based on, is the cost of your coverage for you, the employee, more than 9.5% of what your employer pays you for the employee-only benefit?
Okay, wait. So I think I followed that. Say that
Sure.
one more. Say that one more time.
Okay. So in order for coverage to be deemed affordable,
right?
Okay, it has to be less expensive for the employee than 9.5% of what they earn for their employer for their job against the cost of what the employee-only premium would be. So doesn't factor in what it would cost for spouse or children, just for them. If it is deemed affordable and if it meets the essential health benefit, they can't get the subsidy, which is fine, except for what if employers, in order to contain the costs and to get things affordable, switch those contributions over from the dependents that maybe they were contributing for before over to the employee to get the employee in that affordability zone. Now they don't have to worry about the penalty because all their employees have affordable coverage, but the spouse and the kids are not going to be able to qualify for subsidies on the exchange, which could make it very unaffordable for them.
I think we've established